Simone is a naturopath, kinesiologist and an intuitive healer. She's one of Australia's leading lecturers in kinesiology, so I'm so excited to have her talking about kinesiology today. Welcome, Simone.
Hello.
It's good to see you back here.
Nice to be here.
So what exactly is kinesiology?
It's a technique that uses an indicator muscle to assess levels of function within the body. So that's its technical description.
Yeah.
In different countries, it has different applications. In America, for example, the technical word kinesiology refers to the way we move, the function of the body. And we generally know that it comes, the study originally comes from looking at muscles and how the muscles work together as a group.
Okay, so that kind of sounds a little bit technical.
It is a bit technical.
So I've been to a few kinesiologists, including yourself. So it looks kind of a little bit odd what the person's doing. You don't quite understand what it is. So what goes on when you're, touching your arm and doing all that kind of thing?
Yeah. So we use the arm as an indicator muscle to assess what's going on with the body, and we can ask what depending on what the person's after. So some people might come in because they have an emotional issue that they're dealing with. Other people might have a physical problem. Mm-hmm. And depending on what their goal is, we then assess what part of the body we would test up or what we're looking at.
Okay, so you can test different parts of the body, not just the arm?
Yeah, and even when we say parts of the body, we can test every individual muscle, which is really interesting, and we can look at compensation. Some muscles overwork, some muscles underwork or underfunction. Mm-hmm. And when we have that happening, we can get a lot of what you're saying before, compensations that create irregularities in how we walk, how we sit, and then create tension and other problems. So that would be when we're just looking at the muscles themselves. Okay. But most people would probably be familiar with what we call applied kinesiology, which is looking at assessing different levels of function. So the biochemistry, the emotional realm, the spiritual realm of the body, the digestion, nutritional supplements. So it's one of those modalities that you could basically use to test up anything.
So how when you say you can test all these things like digestion and supplements and things like that, how do you go about that? What happens?
So, for example, if you were testing the digestion, there might be indicator points on the body that you would use to represent the stomach, for example, mm-hmm. and you would use indicator muscle to assess whether it was under-functioning or over-functioning. So an over-functioning stomach might indicate that you have high acid. An under-functioning stomach might indicate that you have low acid.
So I'm trying to get my head around this. So does that mean, that there's messages that come through the muscle that you interpret?
Yes. So you can use the indicator muscle with a yes-no question. Mm-hmm. And depending on what you're using, you can go into more detail. So, for example, you can use a scan sheet, and the scan sheet will have a body of information. So if you're looking for something to do with biochemistry of the body, you would go through a sheet that refers to different hormones. Mm. Yeah. So
is it like these secret little messages that the body's telling you that you interpret as a practitioner?
Well, when you're working as a practitioner, your aim is to relieve often pain. So whether that be emotional pain, physical pain, but also to create optimum health so that person can function at the highest level possible. Mm. So when you're looking at what that possibly could be, that could be operating on lots of levels. But what I've found is generally most of the time it will often feed back and be relating to an emotion.
Okay, and then I suppose when you work this out, the emotion, can kinesiology help with this?
Well, it's quite interesting. Often when people go to a kinesiology for the first time, they're quite surprised that they're actually able to get a sense of what's going on in the body without the person even telling them much about it. So they might be able to assess that they've got a stomach problem, and then they'll be able to perhaps even tell them a date or a time or an age when that stomach problem began.
Wow.
Yeah, you can get that particular. And then looking at what was going on at that time and assessing perhaps what was the trigger or the factor that led to that ongoing stomach issue. Okay,
so there's questions that go on, and then and do you use this tool to help? Because once you work it out, is it through nutrition and whatever that helps, say, with the stomach, or is it through kinesiology can help as well?
So, again, it depends on the practitioner. Like, different practitioners specialise in different areas. Originally, as being a naturopath, I was really interested in using it to confirm nutritional supplements.
Yeah.
But the more that I explored it, the more I found out that probably the most effective thing was to look at the emotion and the cause of the actual issue in the first place.
Yeah.
And I tend to use more supplements to support the body rather than necessarily fix the problem. It's part of the supportive process of healing, not necessarily the only way in which that can create, the healing to occur.
And I mean, you've come on the show before and you touched a little bit about emotional blocks. And is this part of it? Can you explain again a little bit about that?
So my interest was looking at how emotional health is connected to physical disease. And in doing 30,000 hours of clinical experience, you tend to find patterns. And so in that, I would find that there would be often an emotional experience that would occur, and that emotional experience would also be related to a particular time and age, and then also related to a particular person or an event.
And so what kind of person would benefit from seeing a kinesiologist?
Well, when I was first in practice, a lot of people I would see were people that had pretty much tried everything else. And they were looking for answers, because often they tried normal types of medical lines like pathology tests, and they weren't able to assess anything that was on a pathological level, so it didn't have disease. And then they might try other types of things like going to a naturopath, and then after they've gone through all these different remedies or treatment protocols, they'll then find that they haven't got the answers that they're seeking. And so what's really interesting about kinesiology is that it has its own way of finding out information which is perhaps a bit obscure or difficult to find.
Well, that's true, especially when you say that you could work out a time and event in a person that has affected you. I mean, what tests are there that's going to ever determine something like that?
I know. Well, that's what's quite fascinating about it, and I think people are often blown away about how accurate it can be.
Because I think it's one of those modalities that people don't quite understand, and even as myself, having gone to a few of them, I still half the time have no idea what they're doing. They don't really say much, and sometimes, and yourself is not included, they are a little odd. The odd kinesiologist. Is that a prerequisite for a lot of them?
Look, I think it's one of those modalities that lends itself to lots of different people.
Yeah.
And it's also a modality that people have gone and had themselves cured with. So they've had an experience.
Yeah.
It's been, not that I like the word cure,
Yeah.
but they've had an experience where they've found that they've benefited from it greatly.
Yeah.
And they've been very excited about that. And on their journey, they've become a healer. So you get all different types of people. But
I don't mean to put them all in a box, and I didn't put you in it.
But look, I think what's really important, if you did see a kinesiologist, that it doesn't have to be so mysterious. You can actually ask some questions about what they're doing. And being a teacher, I often like to talk through the process and explain what I'm doing and what I'm looking for. And that often helps the person to feel more comfortable. And we all like to know. Let's face it, we all like to know.
Yeah. And I suppose when you say that, I'll go back to the person and place time that has affected you, that maybe that's the need to see a counsellor or look at another, another part of yourself that you hadn't really thought to delve into. Is that,
Well, I think the whole point of coming to see someone like a kinesiologist is to find out something that you haven't known.
Yeah.
So the assumption is that you probably would discover something. And in that discovery, sometimes it can be a huge revelation. And often if you've had trauma, it'll be something that you've locked away so deep within your subconscious that you've even forgotten that's happened.
Yeah.
And so especially when you talk to people and they say, I have no memory of my childhood, often that can indicate that there's a lot of trauma that child or person's experienced that they're not wanting to recall or remember.
Yeah, wow. And they just don't want to, if they've blocked it, is that?
Yeah, and to be honest, they had to, because if they hadn't have, they probably wouldn't have functioned. But now when we're a human being and we're older, we have a different situation that we live in, and often the mechanisms of survival, which is shutting down or shutting off, doesn't always allow us to have the best functioning life.
Yeah.
If we were shutting down all the time, we wouldn't be able to make important choices and decisions.
Well, that's true. So if, in conclusion, because we're running out of time, what kind of message would you give to people who are kind of thinking about kinesiology?
I think, as I said before, it's really important to understand what it is that you're wanting to explore, so to have some sense of a goal. But you don't necessarily have to have a goal. It's really one of those things that if you come in and you're not feeling quite well, or if you're unsure, or there's something that doesn't seem quite right, it can be a really good modality to just find out perhaps what's underneath that feeling of unease and explore it further. And there's no particular person, there's no particular situation. Obviously, it's always interesting when you work with skeptics. But in saying that, I think that probably you have to appeal to people's logic. So it's more important that you are matched to a practitioner that talks about things in a language that you understand. And that might be potentially with a little bit of science or a little bit of spirituality or a little bit of whatever it is, more mechanical stuff, or